All right, y'all. Welcome back. That was super cool video on human life services. We appreciate everything that they do. But next up, Yaz, who do we have
We
coming in
have
here?
we have Steve Kurtz coming up
Kurtz?
as he is the director.
Executive Director, Katallasso Family Health Center, and we have Dr. Tomi Uwazoda, a volunteer provider and board member. Doctor, did I hit it right? Oh, okay, great. All right, cool,
Yay!
awesome. Thank you so much. Thank you both for being here. This is fantastic. I know Steve, you were you were off site last year.
Yes, we were.
Okay,
You
cool.
came to visit us last year.
That's right. Yes, we came to visit y'all, so we appreciate y'all coming here.
Oh, it's nice.
Thank
I
you.
think this is fantastic. And now, Doc, we have a very unique perspective here. So
Mhm.
I'll let you two introduce yourselves and what it is that Katallasso provides and your
Sure.
services. But I'm really intrigued to hear from Doctor because I love the volunteers' perspective. So, yeah.
Well, yeah, I've been here a lot of years, so you don't want to hear any more from me. Yeah, I'm Steve Kurtz, Executive Director. Just my privilege to serve alongside some of the best people in York to serve and provide health care to those that do not have health insurance. So we come alongside them,
Okay.
provide medical primary care, as well as a lot of specialties based on our volunteers, about 36, 37 volunteer providers. Dr. Tomi is one of them. And I only brought her this year to see if you could get her name right. And you got it.
You nailed
You,
it.
you
Okay, very
did,
cool.
you did
All
it
right,
too
sweet.
quickly. And I feel kind of deflated. I don't know. So
No, that's fantastic.
again, Dr. Tomi's been with us since she came through residency at the York Hospital Residency Program, served, and
wow.
then stayed here in York. And anyway, I'll tell your story, but you go ahead.
Yeah, no, yeah. You want to tell your story for sure?
Yeah, I started with Katallasso in 2014,
Wow.
and we've just seen such an incredible growth since then. Like Steve said, we serve people that don't have insurance. So that's anybody from, we have a lot of people that are in between stages.
Sure.
I know a lot of people have been in that place where they have to leave the workforce to take care of a parent, so they don't lose insurance, so they lose their insurance. Or we've had a lot of missionaries come by. We've just had everybody, students, young people, old people. So we've had a lot of people come through, and it's just been such a privilege to be able to walk alongside of them. Some of our values are making sure that people that come through the clinic feel valued and loved and truly respected and cared for, regardless of where they are in life, whether they have money, whether they don't have. So it's just been such an incredible blessing. As a provider, I've just really, really enjoyed being at Katallasso because you don't have all the pressures of you have to see a patient every 5 minutes.
It's not transactional.
It's not transactional. Like you have time to really listen to their stories. So I've been incredibly blessed by that, to be able to just sit down in the room, no rush, just be able to really listen to people.
That's really neat, and I think
Yeah.
that's something that's wildly missing from our modern care system. And I think that doctor-patient relationship. 'Cause I remember, decades ago, that was like a thing. Like your doctor was someone in the community. You know
Right.
what I mean? And it's not to say that our doctors aren't now, but I mean they were literally like part of. You know what I mean? Like,
Right.
I mean, you were there. Your kids associated with their kids, and they were
Right.
always part of that.
Yeah.
Again, that relationship. So, has given the difficulty that the healthcare system has seen, has Katallasso, have you grown because of that? Because I mean, having health insurance is tricky these days.
Yeah.
You know what I mean? So have
Yeah.
you guys seen growth? I guess sadly, because
Yeah.
the more people you're helping, that means
Yeah.
the more people that don't have insurance.
Yeah, we actually just celebrated our 5,000th encounter recently.
5,000?
Yeah.
Wow.
So,
over
Over
5,000
5,000 patients
individual people.
Yeah.
Wow.
that we've
Congratulations.
served. Yes. So it's really been such a blessing, like you said, to be able to sit down and be in the present with people.
Yeah.
And we've also grown, not just in terms of our patients, in terms of the services we offer. So we have multiple specialties. Like, where in York can you go to where you have your surgeon and your podiatrist and your endocrinologist and your dermatologist and your psychiatrist all in the same building? So we're able to do like very, very smooth handoff. It's like even though we provide free services, it's actually great care.
Wait, so you guys do all of that in house? You have the specialists, so you don't even.
And cardiology.
And
Mhm.
cardio-
Wow.
Yeah.
Okay, that was actually gonna be my follow up because
Yeah.
I was gonna say, at what level of care do you start and stop? But you guys go clear through specialty.
Correct. Yeah.
Wow.
And we have a community agreement with WellSpan. They've been very generous in terms of being able to refer in, doing labs and imaging for us. So there's where we don't have a specialty and a need, we're able to refer in fairly
That's
good.
seamlessly.
That is
Yeah.
that's amazing. That is amazing. Yaz, do you have any questions at all for these folks?
So, how does the money that we get from Give Local York that transfers to you help your program?
How does it
So
help?
how does the money that you
Yeah.
get from Give Local
Okay,
help
help.
Katallasso?
Well, we're completely donor supported. We don't
Wow.
take state or federal funding, so it's absolutely critical. Yeah, as Leona said previously, it's one of our favorite days. One, because it raises needed resources, but also visibility. We get to come out and meet new people and be introduced to the ministry in the clinic. But yeah, everything is we survive, and our patient care is directly delivered through the volunteer or through the donations that are made. Yeah.
Wow. Okay, so I mean, today again, it's your
Yeah.
day. Like today is a hinge foundational
Yeah, we
cornerstone. to
appreciate
your
all of the
operation.
sponsors,
Absolutely.
what you, Lisa, have done to gather this movement. It's a great blessing to our patients.
That's
Yeah.
cool. No, I'm super glad to hear that. And we're winding down. I believe we have one spot left on the ripple effect, and you guys are you're gonna close it out. So
Yes.
so you get to come out, and I guess yeah, we have the top spot here. We want to raise a glass and toast and cheers to the York Water Company, to Katallasso. Thank you all for
Yes.
what it is that you do in the community, making us healthier, making us happier. And cheers to you guys. Thank you so much.
Thank
It's a
you.
pleasure. Yes.
So who wants to do the honors? Who wants to come through
ahead.
and
Go ahead.
all right. Oh, come
I-
on, Doc. All right, yes. Show us what you got. So you just kind of poke, see that that last one that's complete? So poke through there. No, the one next to it. Yep. Yeah, right there. So work around the sticker. It's probably easier to poke through. Might have to put a little. There it is. Okay. All right. Oh, it fell down. Yep. Like I said, that thing's been held together. All right. What do we got?
You got $30.
All right, an extra $30 going to the Katallasso Family Health Center. Thank you both so much. We appreciate
Thank
you
you.
guys being
Thank you.
here. Thank you again to all of our donors. Give Local York 2026. We are in the last 15 minutes. Get out to the website, make your donations, go check out Katallasso Family Health Center, learn more about them, ways you can help, make those donations. We will be back with our last guests.
That's crazy.
Wow, that is crazy.
That's
So
crazy.
we'll be back in 30 seconds, y'all. See you soon.
Wonderful.